I'm Dr. Rashmi Halkar Singh. I'm the Deputy Editor of Headache, and it's my pleasure to be joined today by Dr. Kerry Knievel, who's one of the authors of a recent publication entitled Quantitative Analysis of Thecal Sac Volume and Morphology as a Diagnostic Tool in Intracranial Hypotension. Welcome, Dr. Knievel. I'm so happy to talk to you about this manuscript.
Thank you so much. Thank you for having me, Dr. Halkar Singh.
So, first of all, this is a really exciting piece of work. There's a lot of interest in intracranial hypotension, but I'm curious, what inspired you and your colleagues to do this research?
I think really first and foremost, it's our patients, specifically patients with CSF pressure and volume disorders. I think this is really a big evolving field in headache, but it's still one of the fields where there's a lot of unmet need for our patients. Often we have difficulty finding the site of leak, but we have a very high suspicion, a high clinical suspicion, and even sometimes a high imaging suspicion that patients have spontaneous intracranial hypotension. So we wanted to look for potentially some other causes or imaging biomarkers.
Oh yeah, that I mean, what you said resonates with me so much with all these patients. I think that I have in my clinical practice, some which I actually share with you, that we consider the diagnosis of intracranial hypotension, but that source of leak can be so challenging to find. So, tell me about your study. What did you all do?
So we for standard of care for the majority of our patients with spinal CSF leak, spontaneous intracranial hypotension, we obtain an MRI of the spine, heavily T2 weighted, to look for epidural fluid. So we used patients who met the diagnostic criteria, the ICHD-3 diagnostic criteria for headache attributed to low CSF pressure. So they either needed to have a low opening pressure, less than 6, or brain or spine imaging findings consistent with CSF leak. So we compared those patients' MRI spines to age, height, and sex-matched controls and evaluated the volume of the thecal sac using a volumetric analysis software for MRI.
And so, what did you find? Like, what were the key takeaways, and did anything surprise you all?
Yeah, well, we didn't really know what to expect, but we did find a statistically significant difference, a larger CSF volume, a larger thecal sac volume in patients who met the diagnostic criteria for headache attributed to spinal CSF leak.
So, what does this mean for clinical practice? As a clinician, what should I take from your work?
Yeah, I think the main thing that I think is an open mind, and I think we need this anyway with regards to this diagnosis, to think that we know everything about spontaneous intracranial hypotension and spinal CSF leak. Just it does not make sense. We have a lot of patients who were either unable to find a leak due to a dural defect or a leak due to CSF venous fistula. And certainly we've improved our imaging modalities and techniques with our given imaging modalities, but still there's a lot of patients who we have a very high clinical suspicion, whether they have abnormal brain or spine imaging findings or not. We have a high clinical suspicion that they have spontaneous intracranial hypotension without an identifiable leak. So perhaps there's something else. Perhaps not all patients have a dural defect or a CSF venous fistula. Maybe there's something related to compliance of the dura. We certainly know that there's a component or a association with connective tissue disease. So perhaps there's just something else going on. And the findings in this study do kind of support that there could be a stretching of the dura in the thecal sac or some sort of compliance change for some patients with spontaneous intracranial hypotension symptoms.
I think this really adds to that conversation. Hopefully, there's more research coming.
For sure.
So, any final thoughts that you want to share with our audience?
Yeah, I just think just in general, this is one of our more debilitated patient populations and certainly one of our more refractory patient populations that we see in practice. And I think just not giving up on the patients for sure, but not giving up on this as a potential diagnosis or underlying etiology for their symptomatology, just because we don't have abnormal imaging or just because we don't have a clearly identified leak. There's probably something else going on. You know, we've improved our imaging techniques and imaging modalities, but there's still a large population that we can't help here. And so there's something else going on. So we just need to, you know, keep the interest, keep the curiosity, and keep looking into this.
Well, thank you so much for your work. Your passion is very clear, and we really appreciate everything you do.
Thank you so much. And I just also want to thank the Spinal CSF Leak Foundation for the grant that supported this work, and also the research program and the other physicians and providers at the Lewis Headache Center at Barrow for participating in this research.
Fantastic.